Well, it's time now for Health Report, and here is our Africa 54 Health correspondent, Linord Moudou, with a look at children and heart disease. Linord.
That's right, Vincent. February is Heart Health Month, and today we look at children and heart disease. There are many different types of heart problems that can affect children. They include congenital heart defects that children are born with, heart disease acquired later in childhood due to illnesses or genetic syndromes, and viral infections that affect the heart. According to the World Heart Federation, rheumatic heart disease, a disease caused by a streptococcus bacteria, is the most common acquired heart disease in children. An estimated 32.9 million people worldwide have this condition, most of whom reside in low to middle-income countries. Health experts say children in sub-Saharan Africa are affected by RHD. However, diagnosis and treatment remain challenging. And joining us live via Skype from here in Washington, D.C. is Dr. Andrea Beaton, a cardiologist with the Children's National Health System. Dr. Beaton, welcome to the show.
Thank you so much. It's a pleasure.
So tell us about this streptococcus bacteria. How is it acquired?
So the strep bacteria is actually the same bacteria that causes the very common strep sore throat that we hear about and experience all the time. But left untreated or undertreated, in some people, it can cause an overreaction of the body's own defenses, what we call the immune system. And the immune system, when it overreacts, can damage the heart valves. That occurs during a reaction called acute rheumatic fever.
Okay, is this just with children or adults can experience this as well?
So while it can happen at any age, children are most susceptible to strep infections and get them most commonly. And rheumatic fever is most common in school-age children between the ages of 5 and 15.
So let's talk about RHD. Tell us about how prevalent it is in sub-Saharan Africa, because it is one of the most common conditions among children. That's very surprising.
It is surprising, and you're pointing out something that's very important. Rheumatic heart disease does not get as much attention as it should based on the burden of disease that it is in places like sub-Saharan Africa and other low-income countries. Our work has shown that rheumatic heart disease affects up to 4 out of every 100 school-age children in Uganda, where we work, and we've seen similar prevalence numbers coming out of the rest of sub-Saharan Africa, Southeast Asia, and other areas with low resources.
Let's talk about solutions in terms of treatment, even diagnosis, because these are some of the challenges in sub-Saharan Africa. You have done extensive research on this area. What can you tell us? You also support the use of telemedicine. Tell us briefly about this.
Sure. So let's start first with how we can prevent rheumatic heart disease. So rheumatic heart disease is typically progressive. So every time a child who's susceptible gets another strep infection, it causes this immune overreaction rheumatic fever, and there's further damage to the heart valves. If we can find rheumatic heart disease early, a simple and affordable antibiotic, penicillin, given regularly can prevent recurrent strep infections and prevent further damage to the heart valves. Unfortunately, rheumatic heart disease is typically found late in the disease course in places like sub-Saharan Africa. And at that point, the only solution to severely damaged heart valves is a heart surgery, which is so rarely affordable or available in areas where rheumatic heart disease is prevalent.
So how does telemedicine come into this quickly?
So our work at Children's National has been to develop solutions to find rheumatic heart disease patients earlier. We were part of the research team that initially found that echo screening, or an ultrasound picture of the heart, a simple movie of the heart, could find rheumatic heart disease long before clinical symptoms were present. We used that technology to screen over 15,000 children so far in sub-Saharan Africa and Uganda, and what we've been doing is studying how to make echo screening affordable, sustainable, and acceptable in low-resource communities. We've done the majority of this work through telemedicine, which is being able to share knowledge and images through a distance so that we can do the majority of this work from our offices here in Washington, D.C. We've been using something called task shifting, so moving ultrasound screening to low-level healthcare providers.
We have to leave it there, Dr. Beacon, and we look forward to more on your research. Thank you so much for joining us.
Thank you.